friends, this is Nishant Gautam, Associate Professor from the Department of Pharmacology. Today we will study about the pharmacology of coagulants and anticoagulants. According to your syllabus, this is the third chapter of your second unit, that is the pharmacology of drugs acting on cardiovascular system. So, in continuation to part 1 of this chapter, now we will continue with the topic coagulants. So, first we have to know about the coagulants, the definition of coagulants. So, what are the coagulants? Actually, these are the agents or the substances which promote coagulation and are indicated in hemorrhagic states. Generally, we know that the fresh whole blood or plasma provide all the factor needed for coagulation and are the best therapy for deficiency of any clotting factor. Also, they act immediately, so we are using natural coagulants for the therapy. Now, let us focus on the different kinds of the coagulants or the coagulation agents which we are using therapeutically for the coagulation purpose. The first one is the vitamin K. The vitamin K is further categorized into the three categories, the subkind of which is the vitamin K1. We can get this from the plant source and it is fat soluble. The example of this is the phytonadione, also called as the phylloquinone. And the another category is vitamin K2, and the example of which is the menaquinone. And the third category of vitamin K is the vitamin K3, which is a synthetic type of the vitamin K. The subcategory of vitamin K3 is fat soluble and its example is menadione and acetominophen. And the another category in addition to this is the water soluble vitamin K3, the example of which is the menadione sodium bisulfate and menadione sodium diphosphate. The another class of these coagulants are we put it in the category of the miscellaneous. This category having the class plasma fractions factor 8, 9 and the mix factors. In addition to this, also the antifibrinolytics are also we categorize in this category. The agents comes under this category is aminocaproic acid, tranexamic acid, aprotinin, fibrinogen from the human, anti-hemophilic factor, desmopressin, adrenochrome, monosamicarbazole and the routine. Now let us discuss with the first coagulating agent, that is the vitamin K. The vitamin K is a fat soluble dietary principle required for the synthesis of clotting factors 2, that is prothrombin, factor 7, factor 9 and 10. This fat soluble vitamin K mainly found in green leafy vegetables such as cabbage, spinach, and other than this also found in the liver and in a milk products like cheese, etc. The vitamin K acts as a cofactor at a late stage in the synthesis by liver of coagulation proteins, that is prothrombin. And in addition to this, the factors 7, 9 and 10. The vitamin K dependent change mainly in gamma carboxylation of glutamate residues of these zymogen proteins, which confers on them the capacity to bind calcium and to get bound to phospholipid surfaces, which is a properties essential for participation in the coagulation cascade. If you will see the utilization of this vitamin K, its fat soluble form are absorbed from the intestine via lymph and require bile salt for absorption. Whereas on another hand, water soluble form of vitamin K are absorbed directly into portal blood, and due to the deficiency of vitamin K, the coagulation cascade get disturbed, and the deficiency of vitamin K occurs due to liver disease, obstructive jaundice, malabsorption, and long-term antimicrobial therapy which alters the intestinal flora. Let us discuss about the vitamin K and its analogues. It is the natural vitamin K or phytonadione. It is obtained from leafy vegetables as we discussed earlier, and it can be given orally or by IV injection. The rapid onset and the prolonged effect is seen with the therapy of vitamin K. And the vitamin K requires bile salts for the absorption. So, if deficiency of vitamin K is there, is mainly due to the obstructive jaundice and any disease involving the malabsorption of the fat. So, because of this reason only, its absorption requires the bile salt. In continuation to the natural vitamin K, let us focus on another kind of the vitamin K, that is the vitamin K2 or the menaquinone. It is mainly synthesized by the intestinal flora. Hence, prolonged inhibition of growth of intestinal bacteria from antibiotic therapy can lead to the deficiency of this vitamin K. Then another is the vitamin K3 or menadione. It is synthetic water soluble analog of vitamin K, and in case of this vitamin, the bile salts are not needed for absorption and it can be given orally in case of obstructive jaundice or the liver diseases, or in case of the weakening of the liver. If the liver is not functioning properly, we can use this type of the vitamin K. Now we will study the mechanism of action of vitamin K, that how it is proceeding the process of coagulation. So for getting that, just to focus on this flow chart. In this flow chart, we can see how the vitamin K regulating the coagulation cascade here focus that oxygen, carbon dioxide plus glutamic acid residues in the factor 2, factor 7, factor 9 and the factor 10 get converted into the gamma carboxyglutamic acid residue in the factor 2, factor 7, factor 9 and the factor 10 in the presence of vitamin K reduced form, that is the hydroquinone. And the hydroquinone, how the hydroquinone get formed? So hydroquinone formed from the vitamin K oxidized form, that is the epoxide, and this conversion of epoxide form to the hydroquinone form takes place with the help of an enzyme called as the vitamin K reductase, which is inhibited by the warfarin. So the warfarin here shows the action as an anticoagulant. Now let us focus on some indications regarding the vitamin K. The dietary deficiency of vitamin K is very rare in adults. However, when it occurs, 5 to 10 milligram per day, oral or parenteral vitamin K rapid corrections the defects. Then, in addition to this, prolonged antimicrobial therapy treatment in the same way as dietary deficiency of the vitamin K. So due to this prolonged antimicrobial therapy, also there is a deficiency of vitamin K due to the decrease in the intestinal flora. And in addition to both the obstructive jaundice or the malabsorption syndrome, vitamin K up to 10 mg intramuscular per day or orally along with the bile salt is given as a therapy. Another indications in addition to previous, the liver diseases, cirrhosis or viral hepatitis also affects the vitamin K synthesis. In case of the newborns, all newborns have low level of the prothrombin and other clotting factors. The cause is both lower capacity to synthesize clotting factors as well as deficiency of vitamin K. The defect is exaggerated in premature infants. The vitamin K 1 mg intramuscular soon after birth has been recommended routinely. Then some of the medical professionals prefer the administering of the vitamin K 5 to 10 mg intramuscular to the mother 4 to 12 hours before the delivery, and the hemorrhagic disease of the newborn can be effectively prevented or treated by the use of this. Now let us consider some more indications of vitamin K in the overdose of the oral anticoagulants. If any by mistake or undeliberate use of oral anticoagulant is there, then the phytonadione, that is vitamin K1, is the preparation of choice because it acts more rapidly and dose dependent on the severity of hypoprothrombinemia. It is measured in the unit international normalized ratio and the bleeding. Then in severe cases, 10 mg intramuscular followed by 5 mg 4-hourly bleeding generally stops in 6 to 12 hours, but normal level of coagulation factors are restored only after 24 hours. This dose of vitamin K will block anticoagulant action for 7 to 10 days. In moderate cases, 10 mg intramuscular followed by 5 mg once or twice according to the response of the patient. But in case of the mild, just omit a few doses of the anticoagulant. Prolonged high-dose salicylate therapy causes hypothrombinemia, where the vitamin K should be given prophylactically. If bleeding occurs, treat as for oral anticoagulants. After the indications of vitamin K, let us discuss about the adverse effect of the vitamin K. Phytonadione injected intramuscularly or given orally, it hardly produces any adverse effect. Allergic reactions are very rare, and sometimes anaphylactic reactions is there, but it is also very rare, but we cannot neglect. And sometimes hemolysis is seen in G6PD deficient patient. In case of the newborn, menadione or its salts can precipitate calycteris by inducing hemolysis and increasing bilirubin load, and also by competitive inhibiting glucuronidation of bilirubin. Glucuronide conjugation is as such inadequate in neonates. Now, focus on the second class of the coagulants, that is the miscellaneous coagulants. In this category, the first drug is desmopressin. It releases factor VIII and von Willebrand's factor from vascular endothelium and checks bleeding in hemophilia and von Willebrand's disease. The next one is fibrinogen. The fibrinogen fraction of human plasma is employed to control bleeding in hemophilia, anti-hemophilic globulin deficiency, and acute afibrinogenic states. The other miscellaneous coagulants are anti-hemophilic factors. It is concentrated human anti-hemophilic globulin prepared from pooled human plasma. It is indicated along with human fibrinogen in hemophilia and anti-hemophilic globulin deficiency. It is highly effective in controlling bleeding episodes, but action is short-lasting, that is 1 to 2 days. The another choice of the drug is adrenochrome monosamicarbazole. It is believed to reduce the capillary fragility, control oozing from raw surface, and prevent microvessel bleeding. For example, epistaxis, hematuria, secondary hemorrhage, and wounds, etc. The fifth choice of the drug as a coagulant is ethemcillate. It reduces capillary bleeding when platelets are adequate, probably exerts anti-hyaluronidase action or corrects abnormalities of platelet adhesion, but does not stabilize fibrin, means not an antifibrinolytic agent. Ethemcillate has been used in the prevention and the treatment of capillary bleeding in menorrhagia after abortion and epistaxis, melanoma, hematuria, and after tooth extraction. With this, This is using in the treatment of the PEH, that stands for the postpartum hemorrhage. The side effects of ethimycin are nausea, rash, headache, and fall in the blood pressure. It happens only after the intravenous injection. The another drug which we are using as an anticoagulant is apretinib, which inhibits the plasmin, kallikrein, and platelet activation. It is mainly used for hyperplasminemia caused by fibrinolytic drug overuse, and also it is used to prevent blood loss from cardiac bypass surgery. And the another drug is the routine. Actually, routine is a plant glycoside and it is claimed to reduce the capillary bleeding. So that's all for the day. We will continue the same chapter in part 3. Till that, have a nice day and thank you.